Hello, I'm Dr. Rudy Kasha, and if you're watching this video, then you are considering a breast augmentation or you're already set up to see me for one. So I want to give you a bunch of information that'll help you along that journey and give you some details so you can ask any questions you may have when we visit together. Breast augmentation, one of the most common procedures that we perform, or I guess you should say the most common procedure that we perform as plastic surgeons, done all across the United States and the world on a very regular basis. It's still surgery. It's not a day trip to the spa, so that's important to know. But it is a fairly simple, straightforward, predictable surgery. So that's a nice thing. So we'll talk through some components of that, and I'll give you some information that hopefully will help. Key concept that I think, this is me personally and professionally, don't go too big. Obviously, within reason, it's up to you. But anything that really stretches your breast tissue out a lot, that will age your breasts more. And cause some changes through that can be negative as time goes on. So that's one key concept to know. Second, we'll talk about implants. So obviously that's the key, the main role player in this whole procedure are the implants. There's really three types, but there's two that we're specifically going to focus on. So there's silicone and saline. We'll come back to that. But there's also shaped implants, and I want to give you some information on that from things you may read online. So shaped implants are the true gummy bear implants. You may hear a lot of surgeons referring to the regular silicone implants as gummy bear implants. They're not really, it's the shaped ones. Shaped implants used appropriately for the right person can make a really nice difference in giving you a very natural look. And so I did like them as implants, but there's a caveat you want to know now. We don't use them very much anymore. So all shaped implants are textured implants. There is some recent research over the last several years that shows an association with textured implants and a rare form of lymphoma called ALCL. And that's only with textured implants, not smooth implants. So because of that, we are not using textured implants that much anymore. If a person really, really needed it and wanted it, we'd talk about some of the risks. The risk between different implant types and manufacturers range from 1 in 3,000 to 1 in 200,000 for the risk profile on developing ALCL. If noticed, it's usually just seen by a seroma or a fluid collection around the implant that's late stage in development, and typically dealt with just by doing what's called a capsulectomy, where we take that capsule out, take the implant out, and that's usually curative. But still, it's lymphoma, and there is risk. There have been some documented cases of death around the world, very few. But because of that, I don't like to use those implants much anymore. So that's kind of the concept on that. They are still available, but that's what you need to know from that standpoint. Another thing that's kind of out in the online and everything that you may read about with implants is breast implant related illness. So with that, we used to not be sure if that was really even a real thing. Now, with recent research, we do believe it's real. I actually know 1 or 2 patients that have had it. And it's kind of, think of it as a situation where your body just doesn't like the implant. It's not truly that it's rejecting it like it would reject an organ in an organ transplant, but it's that your body just doesn't like it, and it's creating almost like a hyperactive immune response to it. And you may have symptoms such as fatigue or rashes, things that you just can't really relate to really what that's coming from. In those patients, which is very rare, but in those patients, the treatment would be taking the implants out, and usually that's fully a curative type thing of dealing with those symptoms. So that's another thing that you may have read a little bit online. So I just kind of wanted to caveat to those 2 issues first. So now getting back to the implants, there's saline, silicone. There's not a best, there's just differences. If the breast tissue is more full overlying the implant, then the pros and cons of those are really kind of covered up and washed away. If the breast tissue is thinner, most people are going to lean towards the silicone because it feels more natural, it looks more natural, and shows less rippling, so they may like that more. The nice thing about saline is that if saline ruptures, it just goes flat. You know it right away. It's easy to identify. You come in and change it out. Silicone, you won't necessarily know because it's a cohesive gel that sticks together. It's kind of the substance of one of those sticky hands that kids play with out of like a gumball machine. So it's kind of like that kind of consistency. So it's just going to sit there. But you won't know. So the FDA does recommend an imaging test 3 years after surgery and then every 2 years to check for that. That's up to you, how strictly you follow that, but that is the FDA recommendation on that. But ultimately, we'll do a lot of stuff to decide what's right for you. It's ultimately up to you to pick that implant. And we'll do a lot of stuff to figure out what's the right size. I'll have you bring in pictures. I'll have you try on silicone sizers at the pre-op appointment. And then actually during surgery, I'll put temporary implants in you that I can adjust up or down, take those out, see what that, once we see exactly what that looks like, take those out, put the actual implants in, and then you're good with the final implants. We have all the implants in the surgery center from all the sizes, so it's really something that I can tailor specifically to you, which is a nice thing to be able to have. So that's the implant, the most important part of a breast augmentation. Access, there's multiple ways to access and put the implant in. Most surgeons, including myself, we prefer the inframammary fold approach. I keep that very small. It's about 3 centimeters, which is roughly an inch. So it's very well hidden, very small. Place that implant under the muscle. That camouflages it better, decreases the ability to see rippling, and it decreases what's called capsular contracture. The rate of capsular contracture is about 3%, and that's basically a hyperactive scarring that can occur around the implant. It's not harmful to you, but just doesn't feel right, and you would need a capsulectomy to take that out. So that's something to kind of know along with that, but that's one of the reasons we put it under the muscle from that standpoint. Risks, just like with any surgery, bleeding, infection, all of that sort of stuff, very low, and you should be fine. But key things to know, there is a risk with any type of breast surgery, a risk of loss of nipple sensation. It's less than 10%, but it is a real risk that does happen to people. So it's something to know from that standpoint. You should be able to breastfeed fine. That shouldn't affect anything from this standpoint. That's involved a little bit with the breast lift side of things, but not with a breast augmentation. A little bit of an issue on the implants too, to kind of remind you of, if you're less than 22, saline is really your only option according to the FDA. If you're 22 or above, you can pick obviously what you want, so that's a little caveat to know as well. But you'll get a big list of things that has all of the risks and things to know about with a breast augmentation, so make sure you read through that so you're fully informed from that standpoint as well. For the surgery itself, we have our own surgery centers. You'd have it done in there with our team, our nurses, our scrub techs, and myself, that we work together all the time. Typically done under general anesthesia with a board-certified anesthesiologist. Hour or less, really, to do the surgery. And then you'd spend some time in the recovery room, you'd go home, come back and see me 1 to 2 days later, and then it's set intervals after that as well. Most people, it's decently sore the first week because it's stretching that muscle out, and then it starts to feel much better after that. Most people would take about a week off of work, and then there'll be restrictions for 6 weeks. So no heavy lifting, no rapid arm motions, no cleaning the house, no vacuuming, no pulling yourself up or pushing yourself up, exercising, that kind of thing, because we don't want bleeding that can cause a hematoma and necessitate us going back to the operating room. So that's something to be very careful about. You'll wear a surgical bra that we'll give you for 6 weeks, and then you'll transition to other normal bras after that. You'll have some sleeping things, sleep on your back, that kind of thing. But overall, fairly straightforward procedure, very common, but still some details you want to be very aware of beforehand as you make your informed decision. So hopefully that helps with what a breast augmentation is and some details there, and I look forward to meeting you.